Physiotherapy is a healthcare profession that designs treatment programs that addresses mobility challenges. This mobility challenge might arise from neurological, orthopedic, musculoskeletal, or gynecological conditions. Physiotherapy helps to restore people to form and function. Physiotherapy helps to improve quality of life, improve activities of daily living, and prevent disability. Many people associate physiotherapy with bony condition. That is right. Musculoskeletal and orthopedic physiotherapy address many forms of bony condition such as fracture, dislocation, or ligament or muscle injury. However, physiotherapy goes beyond bony condition. There are many specialties in physiotherapy beyond orthopedic and musculoskeletal physiotherapy that many people know. Number one, there is neurological physiotherapy. In this area of physiotherapy, people with neurological conditions such as stroke, also known as cerebrovascular accidents, Parkinson's disease, Guillain-Barré syndrome, and many other diseases that affect the brain are managed. We have pediatric physiotherapy. In pediatric physiotherapy, children born with various forms of mobility challenges such as cerebral palsy or people that have injection palsy are managed. We have gynecological or obstetric physiotherapy, also known as women health physiotherapy. In this specialty, women that have obstetric palsy due to labor or childbirth are managed. We have sports physiotherapy. In sports physiotherapy, people with sports-related injury such as anterior cruciate ligament injury, ankle sprain, ligament sprain, or muscle strain are managed. Also, sports physiotherapists, apart from addressing sports-related injury, can develop a program that will help an athlete to reach the peak of his career. What it means is that you don't need to be sick or to be injured as an athlete or as a sportsman to have a physiotherapist. A physiotherapist will develop treatment program that will help you to reach the peak of your career. We also have exercise immunology. In this specialty, physiotherapy develop treatment program that help to improve immune system of people with various forms of immune deficiency or immune challenges. People with AIDS, HIV benefit from well-programmed exercises. Many researchers have found that programmed exercises can help to boost immune system. We have a geriatric physiotherapy. In geriatric physiotherapy, elderly people with arthritis or with other mobility challenges are managed. We have a palliative physiotherapy. In this specialty, people with terminal illnesses are managed. We also have veterinary physiotherapy. In this specialty, animals with various forms of musculoskeletal injuries are addressed. There are many other areas of physiotherapy that I may not be able to list here, but I want to let you know that physiotherapy goes beyond orthopedic and musculoskeletal physiotherapy. Physiotherapy treatment is done through the following means: patient education, exercise-based therapy, hydrotherapy, cryotherapy, chemotherapy, cognitive behavioral therapy, and even manual therapy. Some other physiotherapists employ soft tissue mobilization, use of gym equipment to address patient needs. The treatment technique you need in physiotherapy depends on your presenting conditions. So if you have any of the following conditions I'm going to list, you have to visit a physiotherapist. If you have any of this health condition, or your loved one, or your parents, or your friend have any of this condition, contact a physiotherapist. Number one is fracture. If you have fracture or dislocation or anything that immobilizes your joint, you need a physiotherapist. The reason is this: if you don't use a physiotherapist during fracture, after the fracture healing, you might lose movement in that joint, or the movement at that joint will reduce. You could also lose your muscle mass. During fracture rehabilitation, a physiotherapy will design exercise program that will help to maintain your muscle mass and also to improve range of movement of joints close to the fractured bone. If you have shoulder pain, or neck pain, or hip pain, or knee pain, or back pain, you need a physiotherapist. I know many people already know that physiotherapists manage these conditions, so I don't need to explain further. If you have any of these conditions, a physiotherapist will address not just the pain, but the root cause of any of the following conditions. If, for example, you have back pain, a physiotherapy will assess you holistically. He will be able to find out if your work or your job or your occupation is contributing to your pain. He will also give you some exercises that will help to relieve the pain and prevent further occurrence of this same back pain. So if you have either shoulder pain or neck pain or hip pain or knee pain or back pain or pain at your buttocks, consult a physiotherapist. If you have any disease or infectious disease that reduces your immunity, such as HIV, you will benefit immensely from physiotherapy treatment. The reason is this: a physiotherapist will develop exercise program that will help to boost your immune system. Many researchers have proven that people with reduced immunity benefit from well-restructured exercise program organized by physiotherapists. So if you have any of these diseases that reduces your immune system, consult a physiotherapist. If you have any baby that his hand is unable to move very well after delivery, or any baby that has paralyzed hand due to delivery, a physiotherapy will help. This condition is called Erb's palsy or Klumpke's palsy. It occurs due to damage to brachial plexus during delivery. If you have any child with this condition, so that the child is unable to use his hands, consult a physiotherapist. For pregnant women, they benefit immensely from physiotherapy exercises. A lot of people before delivery go through prenatal exercises. When you start prenatal exercises, it makes delivery easier, and beyond making delivery easier, it makes recovery from delivery easy. For example, if a woman participated in antenatal exercises and sustains obstetric palsy, also known as injury to mother during delivery, after delivery and the person starts postpartum physiotherapy, the person will recover faster. So if you are pregnant or you know anybody that is pregnant, advise the person to register with Women Health Physiotherapy. Physiotherapy exercises will help to make delivery easy. Some of the exercises will help to improve the pelvic floor muscles. Pelvic floor muscles are the muscles that guard the birth canal. So if these pelvic floor muscles are firm, they will make delivery easy. If you are preparing for surgery, such as knee replacement or hip replacement or spinal surgery, you will benefit from physiotherapy exercises. We call these exercises pre-operative exercises. Many researchers have shown that those who participated or engaged in pre-operative exercises recover faster. Their prognosis after surgery is better. If you are preparing for any surgery, or your loved one is preparing for any surgery, remember to participate in preoperative physiotherapy. It will help to improve your recovery. It will help to improve your prognosis after the surgery. If you have any metabolic syndrome, such as diabetes, or heart disease, or hypertension, or non-alcoholic fatty liver disease, or cancer, or dementia, or polycystic ovarian syndrome, you will benefit from a physiotherapy treatment. The reason is this: some physiotherapists are trained to prescribe some exercise programs that will help to reverse these metabolic diseases. Metabolic diseases occur as a result of high insulin in the bloodstream, which is as a result of what we eat. So physiotherapists that are trained in this specialty will help to organize some exercise program that will keep your insulin level low, thereby reversing these metabolic diseases. A lot of people have testified that some exercises have helped them to reverse their metabolic diseases. So if you have any of these diseases that are listed here, consult a physiotherapist. If you know any child that is above 6 months or 2 years or 3 years that is unable to walk, the child might be having what we call delayed developmental milestone. Delayed developmental milestone occurs when a child is unable to develop at the same pace with his peers. It might be due to cerebral palsy, it might be due to Down syndrome, it might be due to autism. No matter what is causing this condition, a physiotherapist will be able to help this child. Pediatric physiotherapists will design some exercise program that will help to improve these children's mobility. If you have facial nerve palsy, or your loved one have facial nerve palsy, which occurs when there is paralysis of facial muscle, you need a physiotherapist. A physiotherapist will design some exercise program that will help to address this issue. Facial nerve palsy occurs when there is a facial deviation to one side due to paralysis of facial muscles. If your child's leg is paralyzed after injection and the child starts limping, we call this thing injection palsy or foot drop. You need a physiotherapist. A physiotherapist will be able to address this challenge. If you know any child that have claw foot is a congenital disease. Many children are born with this in many areas of the world. If a trained physiotherapist in this area can cast the foot of the child, thereby helping to correct it when the child is still within the first 6 months, this condition is correctable. So if you know any child that has this, look for a physiotherapist that is trained in clubfoot management. We call this condition Talipes equinovirus. Patients with cerebrovascular disease, also called stroke, will benefit from physiotherapy exercises. People with tinnitus will benefit from physiotherapy exercises. People with tension headache will benefit from physiotherapy exercises. Mothers that have incontinence, which occurs due to inability to control urine after delivery, will benefit from physiotherapy exercises. Postpartum mothers or mothers that have incontinence after delivery, or mothers that have dyspareunia, which simply means difficulty or painful sexual intercourse, will benefit from women health physiotherapists. So if you are a mother or you know anybody that after delivery passes urine when she coughs or when she sneezes, will benefit from physiotherapy. Now, if you have elderly parents that are having any form of joint pain or joint stiffness, they will benefit from physiotherapy exercises. Also, your parents don't need to have joint pain before they can consult a physiotherapist. A physiotherapist will design some exercise program that will reduce their risk of fall. It has been established that people above 65 years or 70 years have increased risk of fall. However, elderly people that consult physiotherapy services or do some exercise program organized by physiotherapists have reduced risk of fall. Remember, falling in elderly patients is very dangerous. It can lead to fracture, it can lead to death, it can lead to other major diseases. So if you have an elderly parent that has challenges in moving around or has increased risk of fall, consult a physiotherapist. If you're an athlete or a sportsman or have interest in going into sporting, you need a physiotherapist. A physiotherapist will help to manage various forms of sports-related injuries. However, you don't need to be injured before you consult a physiotherapist. Sports physiotherapists will develop some exercise program that will help you to reach the peak of your career. If you're an elderly person having any form of mobility challenges as a result of any of the following conditions: Parkinson's disease, stroke, Guillain-Barré syndrome, or other neurological conditions, you need a physiotherapist. If you have any form of mobility issues, if you had an accident in the past, or spinal cord injury, or any peripheral nerve injury that affects your mobility, you need a physiotherapist. If you have exercise intolerance, if you run for 5 minutes or if you walk for 20 minutes and start panting like a wounded lion, you need a physiotherapist. A physiotherapist will be able to design some exercise program that will help to build your endurance and improve your exercise tolerance. Exercise intolerance occurs when somebody is unable to tolerate few exercises, such as walking for a long time or jogging. But if you have this, a physiotherapy will organize exercise program that will help to build your endurance and reverse this condition. If you have any respiratory disease, such as chronic obstructive pulmonary disease or asthma, or anything that affects your breathing, such as pneumonia, you need a physiotherapist. A physiotherapist will be able to improve your lung capacity and ensure that you carry on your daily activities without fatigue or without difficulty. If you have work-related injuries, if you feel fatigue in your place of work or after going to work, you feel back pain or neck pain, physiotherapists with knowledge of ergonomics will be able to address your condition. He or she will prescribe some exercise program and also recommend some office equipment that will help to address your health issues. If you are a CEO of an organization, I want your organization to be very viable. You want your workers to be very productive. Make sure you consult a physiotherapist with sound knowledge of ergonomics. A physiotherapist will be able to design your workplace so that it will be suitable for your workers. Remember, if your workers are sick, your productivity will be very low. It has been established that when your workers are healthy, your productivity level is high. So if you're a CEO and you wish to experience more productivity in your organization, make sure you consult a physiotherapist with sound knowledge of ergonomics. He or she will be able to design your workplace so that all these musculoskeletal injuries or pain as a result of poor posture in the workplace could be prevented, and this will boost your productivity. Watching this video, you need a physiotherapist. If you wish to build your fitness level, you need a physiotherapist. If you have obesity or overweight and you wish to lose weight, you need a physiotherapist. If you wish to build your career in sporting area, you need a physiotherapist. If you wish to get some exercise that will help to build your core muscle strength, even though you don't have back pain, you need to build your core muscle strength so that this core muscle will prevent further back pain. You need a physiotherapist. In conclusion, as you can see from this, the role of physiotherapists in our society and in the health sector cannot be overemphasized. We play a critical role in addressing many forms of mobility challenges. If you wish to speak to a physiotherapist, you can drop a comment on this video, or you can click a link on the comment section of this video. It will take you to our website where we offer physiotherapy services to our clients all over the world. Don't forget to subscribe to our channel. Also, hit the notification button. By doing so, you'll be notified whenever we release any of our amazing videos. Don't forget to give us a thumb up. By doing so, you too will recommend these videos to other people. Share this video with your loved one. Thank you for watching. Have a wonderful day.